on the anterior side of her chest, she has 10 spots. You want to start those above the supraclavicular and go down. And then she has 4 spots on the side. So if you want to raise your arm above your head for me, listening right here in those 4 spots again on both sides. And then I would listen to your trachea with the bell of my stethoscope, and I would listen on both sides of that as well. And then I will go on to the cardio assessment, and I'm going to have you lay down for me. And I'm going to start by asking you if you have any heart problems within the family.
No, I don't think so.
Any trouble with you, like when you're exercising? Do you get short of breath real fast or anything like that?
No.
And family history of heart issues on either side of the family?
No.
Okay.
No, everybody's healthy.
And then I'm going to start by looking at your jugular vein distension. So I'm looking, and I'll have you turn your neck for me to the left. Good, and that's not distended. So if it was, I would raise the patient's head of the bed 45-degree angle and reassess that. So nope, you are good to go. And then looking at her chest again, I would do the skin to skin looking, inspecting her chest area for any no abnormal pulsations. I don't see any bumps or lumps on her chest. And then I can go ahead and suscitate my points on her heart. So starting off, I have the aortic on this side. I would go to my pulmonic. Herbs is at the 3rd intercostal space, and then I would go to tricuspid, and then the mitral is at the 5th, which is at the point of maximum impulse. I would listen to those points again with my stethoscope with the bell. So the first time with the diaphragm, and then with the bell. And then you can go ahead and sit up. And then I'm going to check your pulses. So I have your temporal pulse here, and again I would check both sides, normal, and then I have your carotid. You never want to check the carotid pulse at the same time because a patient can pass out. And then I have your brachial pulse. Good. Good. And then I have your femoral on both sides. I have your popliteal behind the knee. And then I have your dorsalis pedis and posterior tibialis in the front, on the side of the ankle within the side. And then you can go ahead and stay there, I'm sorry. And then we are going to go ahead and do the abdominal assessment here. And so I would have my patient void before doing the assessment. So I would ask you to void, and then I would have you flex your knees, so I'll have you lay down in bed. And then I would have you flex your knees for me just a little bit, like right in there. And then I would inspect her abdomen, and then make sure there's no abnormalities like pulsations, bumps, lumps, or anything like that. That all looks normal. I'm checking the contour, the size of the abdomen, making sure all that is normal as well. And then I'm okay to go ahead and suscitate the 4 quadrants of the abdomen. So I can start in the right upper quadrant. I would be using my stethoscope with my diaphragm. Then my left upper quadrant, my left lower quadrant, my right lower quadrant. And then I would flip my stethoscope to my bell, and I would be listening to the vascular system. And I have my iliac on top, my aortic, and my iliac on the other side. And then I have renal, and then I have renal on this side, and the femoral on this side, and then the femoral on that other side. And then I'm okay to go ahead and percuss on her abdomen. So I'm going to just go ahead and kind of tap around on her abdomen, and that's all normal. And then I'm going to go ahead and palpate with her abdomen, just making sure that there's no pain or any tenderness in the abdomen. And if she was ticklish, I would have the patient, I would take their hand and set that on their abdomen and palpate at that time. So yeah. And then I would ask my patient if she needs anything else while I'm here. If you need anything else?
No, I think I'm fine.
Okay. And then I would thank her, and then I would go ahead